The long-term care administrator's board meeting is convened at 9:07 a.m. on March 9th, 2021 at the Health Licensing Office in Salem, Oregon. By telephone conference call, I will now call roll. Amy Brown. Mary Rita Hurley. Here. Maggie Hilty. Here. Christine Rather. Here. Dane Jensen.
This is Bob. He emailed April and he will be joining.
Yeah, he
Will or will not?
find it.
Will.
Okay, so I'll,
We'll make note when he asks.
yes, he's not on now. Oh, Catherine, pronounce your last name for me again. I'm so sorry.
Polinich. It's Polinich.
Okay.
Thank you.
Catherine
For asking.
She is here as well. Mary Amick. And I'm Nicolette Riley, and I'm here. Okay. Members, when you wish to speak, please state your last name for the record. For the record, public members calling into the public phone line are asked to email April Fleming at april.fleming, Fleming, at dhsoha.state.or.us and provide your first and last name. Public and interested parties' feedback may be heard during the public interested parties' feedback period if indicated on the agenda. Everyone is asked to use appropriate language, manners, and protocols when conducting board business. And is there anybody on the call from interested parties?
Hey, Dane's here. Sorry about that.
Oh, thanks, Dane.
We had one public member on the phone.
Is there any interested parties on the call?
This is Bob. Earlier there was one person on the phone. She's not speaking up now, but maybe later.
Two.
Oh, yeah, she's still. Oh, there's two of them.
I am. There is. This is Linda Kirschbaum with Oregon Healthcare Association.
Good morning, Linda.
Good morning.
Okay, so we have Linda Kirschbaum from OHCA, and who else?
Hi, my name is Jocelyn Robinson, and I work for Deschutes County Public Health, mostly with long-term care facilities.
I did not hear that, Bob. Can you?
Jocelyn Robinson, I believe is what she said, and she's with Deschutes County Public Health.
Okay, great.
Yes, that's correct.
Thank you.
Thank you. Okay, this meeting is officially called to order. Our first agenda item is the approval of the agenda. Can I get someone to make a motion to approve the agenda? This is Mag. I make a motion to approve the agenda. There's Nikki.
Catherine Polinich, seconded.
Great, and I'm going to go ahead and call a vote for this. So Mary Rita Hurley. Aye. Maggie Hilty. Yay. Christine Prather.
Yes.
Dane Jensen.
Yes.
Catherine Polinich.
Yes.
And Nicolette Riley, yes. Okay, great. Our second agenda item are our reports, so I will turn it over to you, Sylvie, for our reports.
Okay, this is Sylvie. Just a couple quick little things. Under Director's Report, obviously we're in session right now. There's a lot of bills that we're watching. Several I would assume that your association is watching that won't necessarily affect licensure related stuff, but may affect actually how homes are changing or care's been given. But some of the big ones that we are watching that will affect you guys in the long run are where they're adding a new program to us, which is the sign language interpreters maybe. And then the other one is the genetic counselors. So those are two new potential boards programs that would come to the office, again, divvying out the shared assessment out to all programs, so that would affect long-term wise the reduction in expenses for you guys. There's several other things that are going on, but they don't necessarily pertain to you guys. One of them that we are also watching, and we'll see how it goes, but there's a bill that allows for licensing to, when the law says that you must have a high school diploma, there's a bill that says that we can then look at other things if you can't get your high school diploma. So that we'll see how that bill goes, because that's always it's always an issue for individuals who are over a certain age and cannot remember where for the life of them their high school diploma is, or the school has burned down, or the school is no longer around. So hopefully that'll makes it a little bit easier. The other thing that I want to talk about is we sent out several emails, and I'm hoping that you guys all got them, but we sent out some emails regarding vaccines. We would assume that you guys all know about all that, but we wanted to make sure that that got sent out. And then we wanted to just kind of see how things are going with you guys regarding COVID and the vaccinations. Did you get those emails that we sent? Maggie's saying no.
So maybe I blocked you guys. No, I'm just kidding. I'm looking. I don't remember reading it, but it's very likely that I have it.
Yeah, and it may have gone into, because we send it out with an email blast, so it may have gone into your junk email. We might want to double check that. But we do send a lot of emails via email blast with whatever email you have in our database system. And so if you have updated your email, say, with Paige regarding your board membership, that's not necessarily the same as updating your email in our database, so that, but I think, and Nathan's on here, I think that when he pulls out the email stream, that he does it from interested parties, which would include board member emails. So you guys should have gotten it, and if not, it might be in your junk mail. And you can always email me, and Nathan can look at the list to see if your email was on there or not. So,
all right. Or can you resend? Can you resend it, Sylvie?
I can resend it to you. I have it as they send me what's called a courtesy copy, and then it'd be nice if you think your email's up to date and looks up to date. I can actually go and see if it got sent by gov delivery. We have had several times where the other person's email server has kicked it back because it thinks it's spam or some other reason. So if you're in doubt, please feel free to call me directly. I can look it up anytime and let you know.
All right. Thank you.
So any questions on anything to do with COVID? Did you guys getting all the information that you need? Are you feeling comfortable with everything?
Yes.
All right, well, let's just move right along. Let's go through the reports. So in your packet, the first one shows licenses issued. So you can see there, obviously residential care. Our quarters, I explained this a little bit, but our quarters are a little bit odd. So quarter one, where it says 2021 quarter one, that's actually July, August, and September of 2019. It gets a little weird. But those first, the quarter four and quarter one with the 188 and 372, those are the grandfather people coming in. And then after that, a lot of those were still grandfathering. So their application had to be in by a certain date. But that didn't have to be complete by that date. So as they're getting their documentation, then they're getting the license. Because if you go to the next page, you can see under the residential care exam that there was 32 passes for the exam, so we've issued 32 licenses.
So we do want me to share this so people can see it. Is that helpful?
You can if you want. I can do it too. I would just assumed everybody had it in front of them, but you were more than welcome to.
Okay.
Yeah, I mean, can you share it? Yeah, I'm not gonna. I don't print anything.
Oh, step and share.
Yeah.
Can Can you guys see it?
Now we can.
Okay. So this is the first slide I have, Sylvie.
Correct. So if you go to the next one,
On that board.
scroll down a little bit more. So there's where you see the residential care exam. That's the 32. So the 32 people have passed the exam and received the regular license. Those are the people who did not qualify for the grandfathering.
And then this 11 is what? Oh.
Yeah, people who did. Well, obviously, people are allowed to take it more than once. So one would assume that those 11 people, or 11 attempts, the person has turned around and taken it again and hopefully passed. And if not, hopefully they'll study and then we'll.
Yeah, it's just like,
The next slide just shows the licenses broken out by age and gender.
Sylvie?
Yeah.
I have a quick question here. On this slide, it says 2021, and it's showing that people have taken the exam in Q2 and Q3.
So 2021, quarter one, is actually July, August, and September of 2020.
Okay.
Yes, it's the state's year, and that goes by their fiscal year. And so it always is the year that the fiscal year ends. However, the year starts July 1 and ends June 30th, so it gets confusing. Yes, Bob?
I'd like to make an announcement to the folks on the phone to put them on mute, so hold on for a second, please. Everybody on the phone, this is Bob with Health Licensing. Could you put your phone on mute until we get to the public and interested parties feedback portion of the board meeting? Thank you. Carry on.
All right, thanks, Bob. And then I do believe Dane is on the phone, so he's not seeing what we are looking at, Nicolette, just so we can kind of like say it out loud. Or Dane, if you have questions as we're going, go ahead and chime in.
I can see it okay. I'm in front of the computer now.
Oh, perfect. Okay. So the next slide that I was looking at was the licenses done by age and gender. There you go. Yeah. Male, female. They asked me why we picked green and blue, but. And then obviously if you don't want to declare, then you don't have to. But that is for nursing home administrators. So, and it's for active licenses. The next slide is for residential care active licenses. So you can see there that the 34 to 41 age range is the largest group. And for some reason, there's two that are in our database that do not have a birth date on them, which is why it's the two blanks down there in the corner. So hopefully Nathan's listening and he can look for those two, and then he can have the licensing specialist make sure and get the date of birth added in there. Next slide is the long-term trend, and it just shows the...
So these are just people who are holding active licenses, correct? Not necessarily someone that's currently utilizing that license.
It is correct. It is. So it's anybody who's in our database who has an active license. Whether they're actively running a home at the time or not is, we don't keep track of that.
Correct. Okay.
And then this slide here is the long-term trend. Obviously the green line there is the residential care facility administrators, which is that skyrocket jump up from when licensure went into place, and should over time level out. And then here is your financials. So it kind of says a little bit on the financials that weird year. So when it says 2018, it's actually July 7th of 17 through June of 18. It gets confusing, but a healthy good cash balance, and then those are your percentages down the bottom. As we keep growing, the office keeps growing, those assessments change. And then as you guys grew and molded into the long-term care versus nursing home administrators, your percentages also changed down on the bottom. Do you have any questions before we go on to Bob's regulatory report? Okay, go ahead, Bob.
Hi, good morning. This is Bob Bothwell for the record. So in 15-17, we had 29 complaints. There's one remaining open, and we may have indicated that we'd hoped to have it closed by this board meeting, but because of our executive session today, we did not follow through with that, and I apologize, but you'll understand later on. 17-19 biennium, we've had a total of 49 complaints, 20 remain open. And currently, we've had a total of 46 complaints and 32 remain open, 14 closed. Any questions?
Bob, based off of what you said, am I assuming that this one that is remaining open is the one that we are reviewing in executive session today?
It is not,
Okay.
but we'll go into it in executive session.
Okay, so this is Sylvia again. So one of the things that we know that needs to be worked on is alternate sites for the examination. So the statute doesn't say that we have to do it in alternate sites, but I know that that was discussed when the legislation was passed. It just says that it needs to be readily available, and so we were looking at a couple different options, and I'm sure you've already read this. And Cynthia's on, and she can get into more detail if you have questions. But basically what we looked at is a bunch of different options that will, and some pros and cons. She has not heard back from everybody, so there's still some missing information. And then we didn't know how fast you guys wanted to do this. Because currently, any new administrator has to come to our office to do an exam. There is a couple different scenarios that we can do to allow them to take it in other locations, and it will come down to how secure you want to keep the exam, and it will come down to cost. So Cynthia's on here. You can scroll down a tiny bit. HLO, that's obviously our office exam. iLearn is a current system that we have for testing, but iLearn is going to be going away. So iLearn is migrating everything into Workday. And so I'm not 100% positive how that long-term wise will allow for testing to continue, because in order to get into Workday, you have to have an OR number, and you get an OR number when you become a state employee or a board member. So we're going to have to look into that. iLearn currently would be where you could take the test at home. We can limit the timeline so that you will still get the 90 minutes. However, that does not prevent somebody from taking a picture of the exam, screenshots of the exam, having somebody sitting next to them, helping them, whatever. So, because they would be able to take it at home in their pajamas if they wanted. And then Pearson View, PSI, Prometric, and hopefully eventually DMV are all ones that we're waiting on getting information from. You can see there that she got some information from Pearson View that it's about $65,000 annually, regardless if you have one person test or 100,000 people test. So that when you saw that only 33 people had taken the long-term or the residential care exam and passed it. So it was taken, 32 passed, 11 failed attempts, so that's 43. And you divide 65,000 by 43, it's just not cost effective. And then the other three, we don't have all the details on. DMV might be a better because DMV uses a system similar to ours. And so in the long term, DMV might be a best solution. However, things will not happen fast with that due to they're a little behind in their quote testing and renewing people's driver's licenses and all that stuff. So they may not take us on and allow us to use their DMV sites right away. So that might be a long-term good plan, and we don't know the cost on that. Obviously, she hasn't gotten that yet. So those are our things that we've gotten so far. I wanted you guys to talk about it, what your opinions are on where we should go and what we should do. So
this is Nicolette. Did we look at the possibility of college testing centers?
That's what Pearson View, PSI, and Prometric do.
Okay.
Hey, Sylvie, this is Mary Rita. Colleges also have, there is some kind of app that the kids download. I just learned about this weekend. It's proctoring. There's something that it's on the student. I don't know if it was free or not. I didn't ask the question, so that they can't do what you said, the screenshot and all. And you have to stay in front of the camera. There's all these things. If you deviate from that, I know that the professor can get a hold of you and say, hey, listen, you were looking all around the room and up and down and, it flagged you. So I don't know the cost of something like that. I'm just saying there are other ways of doing it. Colleges have figured this out so kids can't cheat.
Right, and that's what Pearson View, PSI, and Prometric, they do that. That's what those are those companies.
Okay.
Yeah.
This is Catherine Kolinich. I just want to speak to a recent experience I had with PSI specifically, but I don't know what it's like with the others. That virtual proctoring is not a well-organized system. You have to have a lot of settings on your computer to make it right, and I do believe that the proctoring is not done within the United States. It's very hard to fix anything if it's broken. I would just be very wary if they say that they're able to do that virtual proctoring, because it is not a good system for specifically PSI. I don't know about others, but I would highly not recommend it. I ended up having to reschedule the exam I was taking for months later to be done in person, even during COVID. So that's my thought, is that if we do any virtual proctoring, it would need to be a system that actually works and is fairly foolproof, because it's too difficult to be done even by a professional.
Good information.
This is Corinthia. I talked to Pearson View, and Pearson View does offer that online proctor testing. I have not actually physically, seen how that system works, but they said that would be definitely something that they would allow us to do, is actually do like a test run to see what that product looks like. PSI and Prometric have not contacted me back, so I haven't been able to speak with them at all, and I've left several messages. So, and then with Prometric, speaking of an unpleasant experience, the person that I did get a hold of, I did not find that the customer service was by any means acceptable, so I have a little bit of concern with that. And then speaking to DMV, Sylvie, I did have a virtual meeting with several people at DMV, and again, like you said, COVID is prohibiting that right now because they're so behind. But they said definitely when this clears up that would be something that they would be interested in doing with us. So, and then, yeah, that's it.
Thanks, Randy. So does anybody have any questions?
Well, this is Nicolette. I look at Pearson View. I think the whole reason of us looking at this is to say, okay, if I have someone in Klamath Falls, is the expectation that they drive all the way up to Salem to take the test? Or, so, when I look at Pearson View and it only has Salem, Portland, and Beaverton and additional partners to come, that doesn't help us. That's really not any different than HLO, really. I mean, obviously, I look at this and think that the DMV would probably be the most ideal because we know that they're spread out all over. But the timeline, Sylvie, refresh my memory. They have, how long do people have to take, when's the deadline that they have to have this test taken by?
Well, all the grandfather people have to have taken it by December 31st. Obviously, yeah, so that's the grandfather people. And then when we get to public comment, Linda's going to be on the phone, and she'll talk a little bit more about it. But she is getting some information to try and figure out how many residential care administrators who are still actively practicing that have not gotten a license yet, because obviously we don't know who, she would know that information, or at least knows who can get that information, and someone who has to compare our licensing information with like the active known administrators at the time, and then do they have a license yet or not. So I don't think she as of yesterday when I talked to her, and she's on, like I said, she's on the phone and she can talk during number 4, but as of yesterday, she did not have the final number yet. So I don't know if you guys want to talk about that and the iLearn option in order to get those people up to speed, because anything other than iLearn is not going to happen fast.
Sylvie, this is Cerinthia. I wanted to answer Nicolette's question. The additional partner site information to come. When this report was put together, Ms. Magdalenas had not provided me all the location information. So currently Pearson View has 4 privately owned sites and then 22 partner sites at colleges and universities. So there's a total of 26 sites available for testing, for walk-in testing in Oregon.
Thank you.
Uh-huh.
Sylvie, on the, okay, so if I'm understanding correctly, and I apologize for even asking this question, I should have looked this up and thought about this before, but so everybody that was grandfathered in and currently has a license in their hands right now has to take this exam by the end of this year, correct?
It would be the individuals who still have the provisional, who have not gone all the way to taking. So there was the grandfather people who didn't have to take a test. Then there were some grandfather people who had to take the test. And then there's just people that haven't applied yet for some reason, who knows, because licensure is not mandatory until January 1 of 22. So come January 1 of 22, licensure is mandatory. You cannot practice as a residential care administrator without a license then. And so if there's anybody for some reason who's currently practicing without a license, they still need to get a license and take that exam.
Okay. And do we have an idea of how many people at this point were grandfathered but still have to take the test by the end of this year?
That would be your provisionals. And when they should be almost gone. So let me get... There's no actual number, but it's... So Nathan, the chart does not have the actual numbers for provisionals. Can you look up in Elite real quick and see how many provisionals there are?
I also think, Sylvie, when we get into number 4, I would be curious to ask Linda Kirschbaum how many individuals they have typically that go through their licensing class on an annual basis, because when I look at the Pearson View, I see the 65,000 and I'm like, holy cow, that's a huge number. Yeah. But if Linda tells us that, hey, I'm putting 250, 300 people through this class every year, and they're going to have to take this licensing exam. Now you're down to like 250. So I guess I'd really like to see roughly how many people annually are going through the courses, and I think that there's other people that offer the courses besides Linda as well. I'd just be curious if we're looking at solid numbers. That, you know, now, I mean, we've had so many people that got grandfathered, but I hate to say it, but a lot of these positions turn and burn so quickly. I'd be curious to know from the consumers out there that offer the classes, how many people they're putting through this class every year, because my guess is this number is significantly larger than what we're putting into this equation.
Yeah, and we can get, we don't have to make a decision today, so we can totally get as much information from Linda as possible. I think before we make a decision, we'll want to do that. We need to know exactly, you know, like even with Pearson VUE, how the one that Serenity has actually gotten in contact with, there's more details that we would have to work out. So do the licensees then, or the applicants go and pay the fee? Do we pay the $65, so we have to collect it? And then if we don't have enough people to pay it, we'll have to pay it anyways, you know. So there's still some things we need to work out. DMV to me seems so much easier. They're in more locations. They're secure. They use pretty much the same testing system that we use. So obviously it would be pretty easy for Serentia to work with them on uploading our exam. And, you know, so, but again, we need more info. So there's no need to make 100% decisions today. Unless you want us on a temporary basis using iLearn to allow individuals to take the test until we can get one of these other places going. That's, you know, a discussion you guys can talk about, because obviously Go ahead.
This is Catherine Kolnich. I'd like to kind of advocate for the iLearn option for the moment, just for accessibility. It feels like we're putting people in a difficult place to say you have to take a test by the end of the year, but with COVID still being an active issue, we're reducing accessibility to people who need jobs, and we need them to be there. I don't know that it's necessarily appropriate for us to be trying to find an option that's 6 months out, it's already March, and putting more barriers in people's way to provide this care that we need them to do. So I'd love to think that we could find some way to make the test a little bit different, to make having it unfactored a little more realistic, and also have some assumption in the ethics of the people taking the test. We're trusting them into people's lives as well. So I would hope that we could trust them to take a test too.
Yeah, I think another, to add to that too, is, you know, you don't want to, it's not just the fact that they have to drive to Salem. I get that. But you're also going from county to county. You're going from different extreme levels. You're exposing yourself to more people as an applicant coming here. And then going back and bringing it into whatever home environment you're working in. And so I get that too. So the iLearn would obviously be a great solution as long as you guys feel comfortable with it. And we could do that even until we got one of these other companies up and running. You know, I mean, it's more about the direction that you guys want to go and feeling comfortable letting individuals take that exam from home. I think one of the things that Serentia needs to check on, though, is that iLearn is going away and everything's going to be done in Workday, and not 100% sure how that's going to work with somebody who's not necessarily has an OR number. So one would assume that you know, because we have non-employees taking tests currently, but if iLearn's going to go away, we need to make sure that that still works. So.
Okay. Well,
So
I'm
we
going to advocate for accessibility.
Yeah. What's right there? Go ahead.
So with the Workday, they already have the provisions in place, or the process in place for individuals who are not state employees. So that's already been worked out. And so that's not going to be an issue at all. One of the things I do want to say is that once you've been put your examination on iLearn, it is no longer confidential. It is out there for the public, and it will, unfortunately, in doing this for 25 years, those questions will be out there and everyone will have those questions. So it will not be a test that tests an individual's ability any longer, because they will pass those questions around. You always hope that people will do the right thing, but like I said, I've been doing this for 25 years, and unfortunately that is just not the case. One of the options that we can look at is making a modified examination to put on iLearn in the interim for individuals that have the provisional and that entire examination that Trampus worked so hard to put together. And in looking at that examination, has some really good questions written. So I think that maybe we could do both. We could keep the sanctity of the exam until we can get the proctoring Pearson View thing up within the 6 months, but in the interim put a modified examination out there on iLearn, and that would still test their ability. We can pick and choose out of the bank of questions that we have, and in the different categories, to ensure that they're still getting a well-rounded examination, but again, also maintaining that large bank of very, well-written questions that we really want to hold in our pocket. When you spend a year and a half on an examination putting it together, just throwing it out there on iLearn is really concerning to me in watching what has happened over the years. Anyway, so that's my 2 cents on that.
Thanks. I didn't realize that, and I agree. The last thing we want is to have these all-out public knowledge and someone's just like memorizing the answers to the questions to take the exam. I know we don't have to decide today. My personal opinion is that the DMV option would be the best option. If we can find out more information about the costs associated with that and the timeline associated with that. I'm also very comfortable what Cynthia was saying about potentially having a modified exam specifically for those with a provisionary license to get licensed. And then, again, as Catherine was saying, though, I just would be curious how long it's going to take for us to be able to do this at the DMV. Because if it is 6-7 months, that only gives people 2 months to get in there, get scheduled, and get a test done, and that's not enough time.
So I can speak to that a smidge, that I have an appointment today with the DMV, and I made it 5 months ago. I tried to reschedule it yesterday, and there's no appointments available in the state of Oregon. I cannot imagine it's going to be less than 6 months.
Yeah.
And this is Corinthia, and again, when you are working with another state agency, you either have to have a memorandum of agreement or a contract, and that minimum is 4 months out. And so then when you're looking at partnering with DMV and doing all of their field testing sites, there's going to be a lot of work done. I can't imagine that actual process being less than a year, honestly. One of the things I think in regards to timeframes, well, first of all, putting the modified one out on iLearn, we can have that done within 30 days. We can also do the Pearson View contract and get that moving eventually. If there's some bigger numbers out there, that would probably take us 6 to 7, maybe 8 months. But DMV at this point, you are literally looking out to a year. So, at least.
So Nathan has his hand up. Nathan, did you have the provisional number? If so, you're on mute.
17. Hello. Can you hear me?
Yes.
Sorry.
You're echoing like underwater.
Okay, now.
A little bit better. Go ahead and keep talking.
Good. division-wise,
So no idea what you just said. So
I
you
think
want
you
to
just said 17.
Did you say 17?
yes.
Yes, there's 17 provisionals out there.
So what about creating this new type of iLearn test to be like an open book style test where the questions are harder because you have access to more material. Therefore, it would be new questions that wouldn't be in the later test.
So you mean like creating new questions or?
Yeah, well, I don't want to say creating new questions. I'm not trying to create work, but if I'm just thinking of the tests that we've taken online, and it's more of an open book style where you have access to more material, so the questions are harder because you have access, but it still tests knowledge and your ability to find resources and kind of understand the material, just as a temporary option until we're able to do a proctored exam.
So that's obviously an option, but it's not something that can be done as fast because this is not the only board that Serenity works with. And in order to create new exam questions, that takes time and you have to resource it and it has to be in several sources. You know, obviously this is a laws and rules exam, so it's basically out of our laws and rules, so it's not that hard, but you can only write a question so many ways. You know, if you were asking how many nurses have to be on staff during the night shift or something, which is more of the nursing home administrator's exam, but you know, you can only ask that question so many different ways. You know what I mean? And so it's all an option. Everything's an option. That's why we're talking about it. So kind of trying to get information from you guys on what you think is the best route to go. So
is the alternate testing
yeah
site, is that only for RCF administrators? That's not for NHA? I, for some reason, thought, I don't know, we talked about this like a year ago. I, for some reason, thought that NHA wasn't eligible for some reason because of the way the laws were written. And so we were only looking at doing this for RCF.
Well, I know it was part of the discussion for RCFs. Let me get the laws out. So nursing home administrators take a national exam, so that
yeah.
might be part of it.
Well, and the national exam is through PSI. That's where I've taken mine, 27 years ago, just kidding. But for some reason, I thought that the state test for Oregon admin was ineligible to be taken anywhere besides the Salem office.
Currently, yes.
Okay. So this is we're only having this conversation about RCF admins.
Well, there's no need. I mean, there's no need to differentiate between the two exams. If we do a contract out for an exam, off-site exam, there's no reason we would exclude the laws and rules for nursing home administrators.
But when we talk about creating an alternate exam to put on iLearn, we're talking about creating 2 new exams then, which is double the work. Right?
Yes.
Because it's completely different.
Well, currently nursing home administrators come to the office to take the Oregon Laws and Rules exam. And residential care administrators also come to the office to take the nursing home administrator, or the residential care laws and rules exam. There are 2 different exams. So if we were to create a modified version of the residential care exam and put on iLearn, the intent it would only be that exam, because that exam then would be for residential care administrators, so the 17 that have the provisional that need to get the permanent, but that's only 17 people, and 17 people can come to Salem. And then new applicants, if we're getting a licensure, or any new person would have to take it. So, and we've had, 33, what do I say, no, 43, 42, 43, whatever. It's been taken so many times so far, so.
This is Corinthia, if I may, Sylvie. In looking at the blueprint map of the examination, I believe that the bank of questions that we have, we can pull enough out to at least make a 50-question examination to where it does not affect the current examination that we have. Because when you have so many questions, you rotate them in so nobody's ever getting the same exam. But I believe that at this point, with what we already have with the questions that Trampus wrote, I believe that we could have a 50-question examination out there within this 30-day time frame, and again, not affect the current exam that we have, if that's an option that the board would like to consider.
Yeah, that's a much smaller exam. So how many questions are on the exam when they come into the office, Cynthia?
75.
So they're asked 75 questions, and you could do an I Learned of 50 questions. So it'll be a smaller exam. That's an option. And then does I Learned rotate the questions, or to where they do the, the randomization?
Well, they can, but if you just take the 50 questions, there's only going to be 50 questions. So everybody will get, those provisionals will get that, the same examination. But if we do that, and then we also move to the option of the Pearson View, then we could do the proctored online testing by the January 1st of 2022. So all the new licensees will have that proctored full bank of examination questions. I think it'd roll smoothly into that process. So if that's something the board would like to consider doing.
So what are your thoughts, everybody?
My first thought is that this seems like a lot of work for 17 people. But my second thought is it's probably something that's good to do to have an alternate site as we continue on post-pandemic. And so, like, for 17 people, I think it's okay waiting a couple of months till we figure out more information from PSI and the DMV and just continue with what we're doing and let everyone know, like, we're working on something else. Because even if we're 6 months out, that still gives everyone new and everyone with provisional another 6 months to take a test in their city. Like, I feel like that's okay. They don't need to be licensed.
Maggie, I wanted to be clear that 6 months out would be the Pearson View PSI options, not the DMV.
What was the time frame on the DMV?
It's going to be, well, first of all, they won't consider anything until this whole COVID thing is over and they've gotten caught up. So who knows? And then also, due to the fact that you're going to have to either have a memorandum of understanding and or a contract, and then working with all of these field sites to have these additional computers put up because they do not want us to use their computers. So there's a lot of IT technical. So we're looking at a minimum of a year out for DMV.
Okay. Well, I don't like that.
I know. But it would be a great site, and eventually I think it would be a great opportunity, not only for your board, but for all of the boards that we administer written exams, which would be a great thing to have.
Well, so then it kind of sounds like I think maybe we should do the 50 questions from the bank on iLearn for this year while we figure out everything else, so that it's more accessible. And then, I don't know, go from there. I don't know. I don't have to take it, so it doesn't really affect me, but I'm trying to be nice and be like, okay, well, yeah, if I lived in like far eastern Oregon, and I'm working full time, I can't afford to take time off and drive to Salem and make, like, that's really rough. And I don't want it to prohibit people from wanting to, like Catherine said, from wanting to be a part of the industry. So if we have to give up 50 questions so people can take the test at home, like, it's probably worth it. That's the nice side of me. There's another side.
Thanks, Maggie. Mary Rita, what are you thinking?
I
Yeah, I got it. I think whatever makes it easier for people. I mean, I think it's archaic that we make people come to Salem. It makes no sense in today's day and age, and there's ways to figure out how to keep people honest. And yeah, maybe it's going to cost some money, but we need to figure that out, how to do it, and let people stay in their own neighborhoods. So I think it removes, by doing that, it removes the barriers. I had a friend just from Portland, actually not a friend, a gal that works for me, that just was down there 2 weeks ago on the 22nd. And she went down the night before, even because she was worried about there could be an accident or whatever. So she went down, spent money, stayed in a hotel, and she was able to do that because her boss let her have all that time off. But people, like Maggie said, if people coming from other parts of the state, it's a hardship. So I think we don't be offended. I think we need to get with the times here and do what other places have been able to do successfully for a while. Aren't you glad you asked?
Yes, I am.
Right, and ultimately at the end of the day, someone passing an exam is not going to tell us whether they're a good person or not. Like, that's really going to come down to them as an operator, which isn't necessarily for us to decide, but for, you know.
Yeah.
Well, and I'd also, again, I go back to, I would be very curious how many people we're talking about. Like, how many people do we think are going to be taking this test in a given year? Because I think kind of
really basic math we neglect. Because if we know how many ALFs are in the state, what is it, like 860 something? And we know how many are already licensed. We have the 17 more with original license, we have the 43 that just passed, plus whoever we can expect on a turnover ratio. I mean, that's the basic math. Linda doesn't have numbers.
Yeah, that's what I'm saying. Like, maybe, and I don't know how this has percent. Maybe we open the public comment. I don't know.
So there's a typed in comment. I don't know if we're allowed to read that.
No, you're not allowed to use the comments during a board meeting because that is not public record.
Well, I'm glad I asked before I said anything.
Yes. You have to verbalize it so the board gets to hear everything that you were saying.
Yeah, because I agree with what you're saying, Maggie, but I also think that there are, we're not going to know the turnover per se. I think what we need to do is talk to the people who teach the class and say how many people are going through this class per year, because then we will be able to know how many new people coming in are going to need to be licensed. So I don't, Sylvie, do we open this up for public comment? Are we ready to open this up for public comment? I don't know how that works. Sorry.
Totally can, because they're gonna go back and forth. As long as we treat everybody who's on the phone the same and give them the same opportunity to talk, that is totally fine.
And we have how many people? I know we said Linda Kirschbaum and Jocelyn Robinson. Has anybody else joined since that time?
Well, why don't you just read, Nicolette, just read the script. We can talk about the exam some more after we do the public comment.
Okay, so at this time, the Long-Term Care Administrators Board will hear public interested parties' feedback. Members of the public, please, until you've been recognized, and once recognized, please state your name and affiliation to the board for the record.
To all the folks on the phone, this is Bob with the Health Licensing Office. Is there anybody that wanted to make a comment?
This is Linda Kirschbaum. I would be happy to comment and answer some of the questions that have come up during the discussion.
Okay, Linda, hold on one second. Is everybody on Teams able to hear Linda?
A little difficult for me.
I'll go turn it up.
Thank you.
I'll hold my phone a little closer.
The volume's down. Okay, so Linda, say something.
Testing.
Can everybody
Much
hear?
Can you hear me okay?
Yes.
Okay, yep, we're good to go, Linda, thank you.
Okay, great.
Sorry about that.
For the record, my name is Linda Kirschbaum. I'm the Senior Vice President of Quality with the Oregon Healthcare Association. We're a private, not-for-profit trade association representing the long-term care sector here in Oregon. Currently, we represent 90% of assisted living, residential care, and nursing facilities across the state. So always interested in what is happening with the Long-Term Care Administrators Board and those impacts on quality care as well as our member organizations. So thank you for the opportunity to discuss the issue today and to look at supporting alternative sites, which was put into the statute due to one primary factor. Assisted living and residential care facilities outnumber nursing facilities by about 1 to 5. So we have roughly 550 licensed ALFs and RCFs across the state in rural, urban, and suburban areas. So hence, we knew that there was going to be a need for access to testing besides coming to Salem. So that really was the intent of that rule, and we're appreciative. I think Sarinthia and the team at HLO have done a fantastic job on pulling together options and resources to fill this need, so thank you for that. We do offer monthly, on average, the 40-hour class that is required for licensed administrators for assisted living and residential care. And we average about 250 folks going through that class. We're actually higher this year because we've gone to an online platform due to COVID, so we've actually had higher than average numbers going through that course, but I would say that's a safe number on an annual basis without COVID, I should also say. So to address that, the issue, I think great solutions on the table. I think a short-term solution for the coming year is possibly necessary. I think we need one more key piece of information to really inform that decision. And then I think you've got some really great options for a longer term, whether that's DMV or Pearson. But we have provided and discussed this issue with the Department of Human Services, which is the entity that licenses the facilities or the communities. And they also keep track of the administrators of record. So we have had discussion, we have provided information, connected Sylvie and Mike McCormick, the director of APD at DHS, has tasked his deputy with helping do a reconciliation of the administrators of records that they have on file with the records from OHA of individuals who actually have a current license. So we can really determine what the delta is of how many individuals are sitting in a building today that don't have a license, because that's kind of the other that's really the universe we're trying to address to make sure that by January 1st of 2022, that they have taken the exam and that they are ready to go. And those facilities, communities will be in compliance with the OARs and with the statute. So that reconciliation is currently underway, and we're, again, working actively with both agencies to help facilitate and inform that work. So with that, I will stop and see if there's any questions of myself.
Linda, this is Nicolette, did they give you any indication of the timeline that it would take to get that information, that reconciliation?
We don't have that dialed in. We had the discussion 2 weeks ago, and Mike indicated that Becky Daniels was going to be working on this. So I forwarded communication, and then I followed up. I was gone for a few days last week, so I just followed up yesterday. And we're hoping, we want to push this because, again, I think the information that you're bringing to bear from the HLO team and, understanding those timelines, whether it's iLearn or, DMV or an alternative, I think, makes a lot of sense. The one aspect, and I think this was brought up, it seems like you could create some more cost efficiencies if you offered, so say for example, the Pearson View, or get my notes here. If you offered that to also nursing home administrators to access, I don't think you need to do that short term. But, I think that, again, the more volume you could run through that. I don't know if there are other boards that could utilize that type of a system, but it seems like if you're going to go that route, those might be ways to keep that cost effective. But the 250 is typically how many folks we're running through. And not that all of those are going to be administrators of record, but typically their intent is to become an administrator at some point. And so, obviously their intent is to get licensed, and that will become the norm, once we get to that final transition period with this policy. We've kind of been in the gray zone for the last couple of years between, folks getting grandfathered and getting their licenses, and then folks that needed to take the exam. The exam was made available January 1 of 2020. So, basically the exam came available and we went into a worldwide pandemic.
You're on mute, Sylvie.
That happens all the time. Sorry. Linda, Cynthia has a question for you.
Yep.
Yeah, so I had, the one question I had for you was, you said there was a key piece of information you still needed, and I was going to ask what that was, and then to the boards and programs, we are licensing office already is moving forward on looking into operating the Pearsons and PSI sites. I'm working with Sylvia on that, so it definitely is something that we are working towards, which again would reduce the cost eventually if we got that ready for all of our other resident programs. But definitely keeping some information. Did you
Linda? We'll have her reach out to you separately.
You are double echoing and nobody's understanding a word that you're saying. So I think I caught part of it. Linda, one of the questions was, which I think you already said, so Cynthia, the additional information she's waiting on is the number of individuals that DHS has that are running homes that are not yet licensed through us. So that's a bit of, there's a person who's reconciling our information and their information, trying to figure out who is not licensed. That's that one. So that's the piece of information she's waiting on. And then after that, you said something about Pearson View and us working on them, but not sure exactly what you were saying, because we were hearing the double, like when you say so it's doing that echoing weird thing. So we didn't catch all that. So I think we can. You want to answer that again? What?
No.
You're not any better.
No good.
No good. So let's continue on with questions back and forth with Linda. We can go back into the exam conversation when we get done. But does anybody else have any questions for Linda? Doesn't look like it. So Bob, you want to see if the other person, thank you, Linda, if the other person would like to speak?
Sylvie, can I ask a question?
And who's speaking?
Yes.
This is Linda Kirschbaum. May I ask one question?
Go ahead, Linda.
Or make one comment?
Go ahead.
Comment? I think just for consideration too with the various platforms, obviously the licensee or the individual would need to bear the cost of taking an exam. So I think that is something to keep in mind that, we try to keep this affordable for folks who want to access, these outside services that, it's not $2,000, not that they would be paying that, but, what is the cost to the individual if they go to a testing center?
Yeah, Linda, and that's exactly information that we don't have yet. So, 100%, we will always offer it at the office, regardless, because that's what we do. But yes, that's one of the deciding factors will be cost of the applicant, cost of the exam and all that stuff. So, yes. All right, anything else, Linda?
I think to summarize, we have 17 individuals who have provisional licenses that theoretically would get a license or would want to get a license or take the exam before January of 2022. And then we have an unknown number yet forthcoming that will be how many individuals are actually serving as the administrator of record with DHS that do not have an HLO license but will need one if they are to continue post January 1 of 2022.
Correct. Yes. So okay, all right, before we go back into the discussion of the exam, Linda, do you have anything else?
No, thank you again for the opportunity, and I'm happy to answer any questions now or later.
Okay, perfect. Thank you, Linda.
Thanks so much.
Bob, you want to see if anybody else on the phone wants to make a comment?
Does anybody else on the phone want to make a comment? Hearing none.
Okay. So let's go back into the conversation about the exam. So currently, so the licensing manager, she says that there's roughly 2 to 3 tests a week that we are currently giving. So 2 to 3 people a week are coming in and taking the test currently right now. Pearson View. So there's still a whole lot of questions that are not answered yet. But so, Cynthia, let's find out. So if it's $65,000 a year, is that just a contract no matter how many tests we do and how many different tests we administer? So because the residential care laws and rules exam and the nursing home administrators laws and rules exam are 2 different exams. So if we were to offer both of those exams, would it still be $65,000, or is it $65,000 per exam? So those are questions that we need to find out. And then obviously some other boards, if it's $65,000, no matter how many different types of exams we do, there might be some other boards that be willing to kick in so that the $65,000 then would get split between several boards versus just this one board. So there's a lot of information that we still need to gather and stuff. So how about...
I have an answer to that question.
We can't understand what you're saying, Cynthia. So when you talk,
okay,
we can't hear you. I mean, we can hear you. It's just does that echoing and like your underwater echoing thing. So.
Is this any better?
Way better.
Okay, so I have an answer to that question.
Okay.
The $65,000 is a minimum contract, and we can have multiple tests under that contract. So the more exams and the more test takers we have, it reduces the number or the fee. So we can have all of our written exams with them. It's the $65,000. Of course, then on top of that, there are other parameters that include technical stuff, whether they approve qualification, whether we approve qualification. So we'll get some specific numbers. But to answer your question, we can have all of our boards and programs under them, and it's just that minimum 65,000.
Okay, and so then here's another wrinkle to that. So just because we keep talking about Pearson VUE, and that's most likely the best one so far, because it's the only one that we have a lot of information on, we still can't just automatically use them. We have to have an RFP. So the state has to put it out for bid. Different places have to bid. We have to evaluate those bids and all that. So we still need more information because we're going to have to put this out to bid if there's more than one, which we know there is, then more than one location that can do basically what we're asking. So the state has to put that out for people to, to bid on, so, for a contract. So, but it sounds, I think the more locations, the better. I don't know how the DMV thing would work long term, because we need some more information on that. And what kind of, it's easier to get a contract with, which is called, like Cynthia was saying, an agreement between two agencies. That doesn't have to go out to bid. So if DMV is willing to do it, that might be cheaper and quicker, contract-wise, not as in DMV can start doing it tomorrow because they're way behind too. So there's just a whole lot of information that we still don't have and we need. So I think that this, between now and the next board meeting, Cynthia will definitely keep working on this, keep getting more information. But we need to know, and if you don't want to make a decision today, then that's fine too. But we need to know if you want to move forward with this iLearn thing, because Cynthia can actually get that up and going, obviously way before your next board meeting.
I do think, at least for those 17 provisional licenses, that's definitely, I think that's the way we should go, at least for those. And then maybe at our next board meeting, we can make a decision on the others at that point. I don't know how the rest of the board is feeling on that right now. I saw a thumbs up from Maggie, but I can't really.
This is Christine, and I agree.
Yeah, Mary Rita, I agree too. Okay,
so let me just clarify here. We are proposing that not temporarily, but for now, that we move forward with iLearn to create a provisionary test for the 17 people that have licenses right now to get them licensed.
Hold on, it would be more than the 17. 17 is how many people we know have a provisional. So when we get the information that Linda was talking about the number of actual administrators who are practicing, who have not yet got a license with us or gotten a provisional with us for some reason, then we'll know exactly how many people who need to take that test between now and December 31st.
Okay.
So it's more than 17.
Okay. Okay, so I guess we're just trying to decide, are we going to use a temporary exam on iLearn that is a 50 question? Is that what we decided, a 50 question, or to tie us over, so to speak, until we can make a more educated decision based off the information that we have? And I believe that I heard from Christine Crowder and Maggie Hilty and Mara Rita Hurley and myself that we are all okay with that. I just would feel a little bit better if I heard from Catherine and Dane on how they feel.
I'm over here nodding. You probably can't hear my nodding, but this is Catherine's phone.
And Dane,
this is Dane. I agree too. That's about
okay.
Like the best we can do right now.
Okay, so yeah, Cynthia, I would say let's kind of look at what the next steps are for that then.
This is Cynthia, and if you want me to move forward, I'll just have it, within the next 30 days, I'll have it up and running. And I'll send out communication and notification to the pertinent individuals.
Okay.
Okay, so let's
do you want to talk about with that?
Well, I think we need to make it a little bit more formal. So I think somebody's going to need to make a motion, but I want to clarify all the little things first. So it's going to be an exam on iLearn. That's 50 questions. Do you still want the pass-fail rate at, what's it currently at, Cynthia, 75%?
Yes.
Yeah, you want the pass-fail rate still stay the same. 50 questions, iLearn. Within 30 days, we'll notify everybody. So, okay, we got all that. So somebody could make a motion. Cynthia, do you have any questions before they do a motion?
Yes, I do. Do you want to give them a time limit on that examination, or do you want it open-ended? Currently, the time limit for the 75-question exam is 90 minutes.
I definitely think if we're going to iLearn and we're going with a remote, there has to be a timeline for it. Otherwise, you're just asking for someone to just pull up anything they want, wherever they want. And so I would say no longer than an hour.
I don't know, 50 questions in an hour seems short. That's what if the question has math?
But it's the same as 75 questions in 90 minutes.
Is it? Is that the same ratio?
Yeah.
Oh my gosh, I just got stressed out. I got like sweating about
doing
I
that.
don't get shower. I'm gonna have to take it, and I'm sweating. All right.
Yeah, 25 questions per half hour is the average, so that's why I said an hour.
All right. Okay.
Okay, so we've got 50 questions, 75% pass rate. You get 60 minutes to take it. It will be on iLearn. And Cynthia will get...
Sophie, I have one more question. Is there a fee for this examination?
Oh, yes. So, because we have, yeah, they got to pay to do it. So it would be the same fee as what they were currently enrolled. Which I
Is that the one? Sorry.
It's 125 for a fee. Is that what it is?
Yes, it is, Sophie.
It says 8 below is 125, so I'm assuming that's what it is.
I didn't want to have to look at that.
You're correct.
Okay. So somebody needs to make a motion, and I can't.
I make a motion to move forward with a 50 exam question, 60-minute time limit, 75% pass rate on iLearn within the next 30 days, please. Whew.
This is Catherine Colin, seconded.
Okay, I am going to call for a vote. Mary Rita Hurley. Aye. Maggie Hilty.
Yay.
Christine Crum.
Yay.
Dane Jensen.
Yay.
Catherine Kolanich.
Yay.
And Nicolette Bradley. Yay. All right,
perfect. Okay, Cynthia now has work to do. Okay, we'll get working on this. Next is on the agenda is item number 5, which is the executive session. So Nicolette will read the script for that. Bob is in, just so everybody's kind of aware of logistics, Bob is actually in the office. So during the executive session, he will mute the public phone, and then he come back out of executive session and do item number 6 and 7, and he will unmute the phone. So the public can stay on the phone if they want. You can welcome to hang up if you don't want to. Regardless, Bob's going to mute it when we go into executive session. So Nicolette, if you want to go ahead and read your script.
Okay, the Long-Term Care Administrators Board will now meet in executive session pursuant to ORS 192.6602F and ORS 676.595 to consider information or records exempt from public inspection at 10:27 a.m. on March 9th, 2021.
Script.
Okay. So the Long-Term Care Administrators Board will now exit executive session and reconvene open session at 12:12 p.m. No final decisions were made and no votes were taken in executive session. The public phone line has been unmuted and representatives of the media may once again report all board discussions and actions.
You have to dial. April, you have to dial us back in.
Hold on, we're waiting on the recordings to get switched over.
We got to get dialed back into public phone. Can you hear me?
Welcome to AT&T's teleconference service. Please
Bob, are the recordings all ready?
followed by the pound sign.
You have to do it. No, they're not ready. Oh, they're getting the phone back up.
Charades.
So the phone line that we allow the public to call in on, if you leave it unattended and we're the only ones on it, and it means everybody else is hung up, and you leave it unattended for like over an hour, it'll hang up. So when we were talking earlier and you said you could hear that your conference meeting is, that was the phone hanging up on the call. No public is on the phone.
You are joining your conference.
So they got to get the phone back up just in case the public needs to call back in. Not saying they're going to, but we have to have it available.
Granicus running?
Yep.
All right, all good to go. Okay, so this is Sylvie. We're on the agenda on item number 6, which is items for board action. Maggie.
Oh, I would like to make a motion on case number, because you guys can't talk with me, case number 20-9924. And the motion I would like to make is to move forward with suspension and the fine previously discussed, in addition to a $250 fine for violation. Oh man, for the 2 violations. For a total of $500 civil penalty. Oh, that was so close, guys. I'm sorry. Close enough?
No.
Okay.
No, the case number was wrong. I think she got the case number wrong.
I'll second it, Mary Rita.
Okay, Mary Rita is a second.
Hey, this is Catherine Cullen. If you can hear me, I'm seconding that.
Okay, and I'm going to go ahead and do a roll call for this. Mary Rita Hurley.
Aye.
Maggie Hilty.
Yay. Oh, Bob, case number was 20-9924. No, it wasn't. That's not the case number. Just kidding.
Heather, can you look up the case number?
Oh, yeah.
I also thought it was 20-9924.
Yeah,
It is
yeah.
for
Yes,
Buzzy.
it is.
It's me.
It is. You're right, Maggie.
Mom apologizes.
Okay, I'm going to continue roll call again. Christine Crowther.
I forgot about that.
Yay.
Dane Jensen.
Yes.
And Catherine Collinich.
Yay.
And Nicolette Riley, yay. Okay, that motion passes. The next case that we are going to, we're not voting on anything else, correct?
No, nothing else. That was the only one.
Wanted to make sure. I'm reading my notes and realizing we don't need to vote on any of the others, so.
Yep.
Okay, so that's it. We'll go to agenda item 7, which is other board business. So do we have any other board business? Can I just confirm again that as of right now, our next board meeting is when? Our next scheduled 9/14.
Says Bob on Postino.
Okay, is there any other business that we need to discuss? Hearing none and not seeing any post-its from Bob. The Long-Term Care Administrators Board meeting is adjourned at 12:16 p.m.